I'm Dr. Bonnie Beaver. I'm a professor in the Department of Small Animal Clinical Sciences at Texas A&M University. I have had a client that came in that had a dog that usually was outside but became afraid of thunder and got to the point that it literally was trying to chew through the brick wall of their home to get indoors. That dog is so phobic that you can't help it anymore. Drugs can help a little bit, but by the time it reaches that extreme, it's very, very difficult to do much for it. This particular research was done to look at fear and anxiety in dogs. There's a large mega study that now incorporates over 50,000 dogs that collects a lot of data about what they eat, where they live, where they came from, how old they are, and it included some behavior questions. Because my interest is in animal behavior, I took a look at those behavior questions specifically, and they did include 9 that related to fear and anxiety. And that resulted in my counting individual 50,000 different dogs and looking at what level of fear and anxiety the owners reported that those dogs would have. This particular study, when we looked at the 9 questions that involved fear and anxiety, we could actually divide them into 4 different components. One would be fear of strange people. One would be fear of unfamiliar dogs, fear of unfamiliar situations like noise or objects on the sidewalk. And then the 4th category dealt with grooming, like baths and nail trims. If we deleted the baths and nail trims, because that's kind of a learned experience that these animals have, it left about 84% of dogs that showed some level of fear or anxiety in the other 3 categories. Of concern is the level of that. And this particular study asked owners to rate the level between 0 and 4, with 0 being none, 2 being moderate, and 4 being severe. And so looking at how owners defined that became important in understanding what these dogs might be showing. When we looked at the overall percent, 84% of the dogs had some level of moderate to severe anxiety. It might be for just one of the 7 questions, or it may be for all 7 questions that we looked at. And so looking at how many were showing that severity was of concern. While many of these situations were probably a one-time thing. Oh, there's a strange person, or it suddenly thundered last night, and that was the first time the dog reacted. There is no way to know, is this an ongoing situation, or was this just a one-off situation? Well, fear and anxiety, if you think of it, is probably a very normal reaction for an animal in an unfamiliar situation. And so we also have to look at how dogs are raised. If they're not raised around other people or other dogs, they easily could develop a fear when approaching someone new. The ultimate thing to look at from my perspective as a behaviorist is how many are really showing kind of the severe anxieties, that number 3 or number 4. Because I think about, for example, fear of noise. Dogs that are afraid of noise, in our part of the world, that means thunder or firecrackers. And I know as a behaviorist that if a dog becomes afraid of thunder, I need to get help to that dog early on, not waiting until it's in the severe category. Owners don't necessarily appreciate that. So as a clinician, I would need to ask the owner, is your dog showing fear of thunder or firecrackers? If so, let's get some help for that animal before it escalates where we can't treat it anymore. Long-term anxiety is affecting dogs just as it affects people. Some dogs are just The world is a very scary place. Those dogs, just as people, need medications to help reduce that anxiety and return them to normal. We often equate it with something like diabetes. Something isn't working right in the brain. In diabetes, it's the pancreas that isn't working right. And so we help them with medication to make things normal again. We probably will see it to some extent more in dogs that live a relatively isolated life. And that could be even in a city, a dog that stays in an apartment and uses a pee pad instead of going out for a walk. We could see it in country dogs. But in general, what I worry about in that kind of a situation would be a dog that isn't around a lot of people and someone comes over to visit. The dog doesn't know what that person is. They really don't appreciate it. But for some reason, owners and visitors feel, I just have to pet that dog. There's nothing that says you have to. Just leave it alone. If the dog is fearful, leave it alone. But people have to touch them. One of the things that veterinarians can do is actually to start asking their clients questions about behavior, not just health, but behavior. We know that most veterinarians do not use an admission form that has questions like we often see when we go to the doctor. How are you feeling? Have you, any intestinal issues or whatever. They need to put some behavior questions on there because it gets the client to thinking, oh yeah, I remember, it isn't thundering, it hasn't thundered for 2 weeks, so it's not on the top of their mind. But if that shows up on a questionnaire, oh, I should ask them about that. So using a questionnaire and even starting to routinely ask certain questions when the clients come in. The risk of not addressing it is that we have fears that will escalate to the point that they become phobias. And when they reach the phobic state, you can't get to that dog. They are not in their thinking brain anymore. And that makes it very difficult to work with that animal and to find a way to help it relieve that kind of fear.